Hi, I'm Hollie Foust, Deputy General Counsel of Cardinal Health.
Hi, I'm Todd Cameron, Chief Diversion Control Officer for Cardinal Health.
In today's podcast, Todd and I will be discussing changes to our controlled substance monitoring program that will become effective on July 1st, 2022. Now, as many of you know, in February of 2022, McKesson, AmerisourceBergen, and Cardinal Health entered into a nationwide settlement with states and political subdivisions. Under that agreement, the three distributors agreed to pay approximately $19.5 billion over 18 years. Now, one component of that settlement that did not get a lot of press is the injunctive relief portion. Under injunctive relief, the three distributors agreed to make certain enhancements to their respective controlled substance monitoring programs. The injunctive relief settlement lasts for a period of 10 years, and the distributors agreed to a 5-year monitorship. Now, the monitor is going to oversee compliance by the distributors to the injunctive relief terms. Today, we're not going to cover every component of injunctive relief, nor are we going to discuss all the changes to our controlled substance monitoring program. So with that disclaimer, Todd, let me ask you the first question. What are the top things our retail pharmacy customers can expect as a result of injunctive relief?
Holly, thank you. And there are three main categories of those changes. The first, I would say, is the due diligence requirements that Cardinal, ABC, and McKesson are required to put into place. They're going to increase. And there's an increased level of scrutiny on the three wholesalers for us to ensure that our pharmacy customers are enacting their corresponding responsibility. The second, it's all around the thresholds and restrictions around those thresholds. We cannot tell our customers what their thresholds are. We cannot tell our customers that they are approaching the thresholds, and we cannot proactively increase the thresholds within the methodology without an official request coming in from our customers. We're also working with a third-party analytical expert that has been used by McKesson for several years, that they are going to help us evolve our threshold setting methodology to incorporate the IR requirements, which were things around segmentation of the customers based on size, type of customer, chain affiliation, geography, and factors like that. But we are still going to have a daily threshold, a monthly threshold, and a quarterly threshold like we do today for every DEA base code for every customer. And then finally, it's all around the independence from the sales force. IR requires independence of the controlled substance monitoring program from the business. And this means, for example, the PBCs, our pharmacy business consultants, who are the sales team that calls on the retail independent customers, they are no longer going to be the contact for our customers with questions around controlled substance purchases. That is all going to have to come directly to our CSMP team members anytime a customer has questions or needs to ask for an increase.
Very helpful. So thanks for bucketing that into three major categories. But let's do a little bit deeper dive into each one. So let's start with those additional due diligence requirements.
The first big change in that due diligence is the fact that we're going to have to go a lot deeper on license and law enforcement reviews. We're now going to be required, all three of us, to perform licensure and law enforcement checks on our pharmacy customers. And this is going to include not only the pharmacy, the pharmacists in charge, but the staff pharmacists and their teams, and the top prescribers that are sending prescriptions to these pharmacies for highly diverted controlled substances. Part of this is we're now going to have to conduct PIC interviews. So the pharmacists in charge at every pharmacy that we onboard, our team is going to have to get onto the phone, get on the screen with that individual, and have a discussion with them around how they exercise their corresponding responsibility to verify the medical legitimacy of all the controlled substance prescriptions that they fill. The PIC interviews will also be conducted on existing customers anytime we see any potential red flags. For example, in the customer's purchase data, that could lead to us requiring a PIC interview with the customer. We're going to continue to perform site visits. We'll really separate those into two different types. One are announce visits, like we do today. They will be scheduled in advance with the pharmacist in charge at the specific site. We will still require a pre-visit questionnaire get created by the pharmacist that gets sent into our team. And again, when we're there, we will have a discussion with that pharmacist in charge around how they exercise their corresponding responsibility to help prevent the diversion of controlled substances. For unannounced site visits, a little bit different. The Cardinal Health CSMP investigator will observe the pharmacy inside and out, looking for any signs of pharmaceutical drug diversion. When the visit's over, the investigator will drop off a brochure to the pharmacist staff that are working that day. It just contains things like industry best practices around, for example, that corresponding responsibility. And it lets them know that the visit occurred. We're not there to collect any data. We're not going to be doing any interviews while we are there. But if any of the pharmacy staff does want to talk to the investigator, if they have any questions around the program, questions around the corresponding responsibility that's detailed in that brochure, the investigator will be obviously very happy to have that conversation with them. So I want to make this point very clear. Because it is an unannounced visit, because it is not scheduled, because we have not given the customer the time to prepare for us to be there, we are not collecting any data. So therefore, there's obviously not going to be any concerns around us collecting any protected health information or any HIPAA violations of any type.
Sounds like the investigator is going to see exactly what any other customer would see when they walk in the pharmacy.
Great point. I mean, they are not going to be going behind the counter like they would on a full visit. It is simply going in and seeing the inner workings from the customer's perspective of the pharmacy. Absolutely. Yeah, great point. And then the final one, which is really the big one, pharmacy customer data. We say pharmacy customer data, so many times we refer to it as PCD, and we're going to be collecting it on a lot of different frequency. One being anytime we onboard a new customer, PCD is required, again, by Cardinal, ABC, and McKesson to be collected. We're going to be collecting it anytime a customer requests that we review a threshold for a potential increase. Anytime we see any red flags from a purchase data standpoint, from a discipline or law enforcement check standpoint, from a regulatory request that may come in to us from a regulatory body, we'll be collecting and requesting the PCD. When we do the announced visits, again, that pre-survey will go out, which will include receiving the PCD back. And we are required, all three of us, per the settlement, to do 500 updated pharmacy questionnaires on an annual basis, and all 500 of those will be resubmitting pharmacy customer data. It is really a big lift, obviously for us, but as well as our customers, and we are required to use that pharmacy customer data, the PCD, to evaluate the total number of prescriptions and dosage units for controls and non-controls that the pharmacies are filling. We've got to identify the top 5 prescribers for each individual highly diverted controlled substance, as well as the 10 highly diverted controlled substances combined, looking at those top 10 prescribers. Things we're already reviewing today, like cash for controls, cash for non-controls, and something new is we're gonna have to look at information on the top 10 patient zip codes that the pharmacy is filling prescriptions for, and evaluate those distances and identify any potential red flags. Again, defined by IR. Because there is this 5-digit zip code component in IR, we have created 2 separate reports, because obviously our goal is to avoid collecting any PHI. The first report is the prescription level detail of what we just talked about. The second one is aggregated in a manner that allows us to do that zip code analysis without getting any PHI information. The IT teams here have reached out to all of the top PMS, the pharmacy management system vendors in the industry, to work with them to get these 2 reports created and into the systems of our customers that are on those PMS systems, to be ready to extract that data and give us the reports in those formats. And we feel very good that the majority of them are going to be ready to go on July 1 to produce that information to us so we can meet the requirements of IR. We've also, and I say you have worked directly with our chain partners to make sure that the large national chains that have corporate offices, that have access to all this information, have the ability to create the reports in the manner in which we need them, and then get them to our team as quickly as possible, so we can do all the due diligence I described, as well as handle the requests for increases to thresholds from customers.
Wow. Well, thank you for doing that deep dive on due diligence, because it is a lot. However, the good thing about injunctive relief is now the distributors have a clear roadmap on what is expected with respect to our obligation to spot, stop, and report potential controlled substance diversion. Do you think that this is a shift in our industry, and that not only the distributors that are governed by IR and other distributors are going to have increased expectations, but also our pharmacy manufacturers with respect to the type of due diligence and the expectations around preventing controlled substance diversion.
Oh, absolutely. IR does provide a new roadmap, quite frankly, of what is expected to help prevent controlled substance diversion. But I think the expectations on the pharmacists themselves and what they must do to demonstrate that they are exercising their corresponding responsibilities has and will definitely continue to increase. To your point, we've already begun to see our manufacturing partners use their chargeback data to identify red flags and reach out to us with questions and potentially actions against pharmacies. We're also seeing those same manufacturers now begin to use ARCOS data, something available to any registrant, through distributions from wholesalers that DEA provides, and they're taking actions on pharmacies based off of that as well.
Oh yeah, and I also have seen that they look at their chargeback data to help spot potential diversion.
Yep.
Now let's shift gears here and move to that threshold limitations that we have in injunctive relief. So under the threshold requirements that says Cardinal Health cannot proactively increase the threshold outside of our methodology, except for in limited circumstances, as well as this requirement that we can't even suggest to customers that they seek an increase to their thresholds. Can you talk a little bit about how that's going to impact our customer relationship?
Sure. IR is very clear, and it states that we cannot tell our customers the thresholds, we can't suggest they ask for an increase, and we cannot proactively increase that threshold outside of our methodologies. So because of that, to your point, our customers will want to monitor their pharmacy's controlled substance dispensing and any changes to their business that may result in an increase to their controlled substance needs. For example, if a nearby pharmacy might close, that existing pharmacy might begin to see an increase in patients, or maybe a new surgery center could open up down the street. That pharmacy may also begin to see an increase in their dispensing and needs for controlled substances. In any situation like that, they should be proactive in contacting us to discuss these changes and potentially request an appropriate controlled substance threshold increase. This proactive approach of the customers monitoring their own pharmacy data and their business model changes is critical for Cardinal, ABC, and McKesson, because we are required, like we talked earlier, to collect that pharmacy customer data. So the sooner that process can start, the easier the review request becomes for the customer, the time frame can be shortened, and it'll lessen the potential impact on patient care.
That's very helpful. Now, in the past, our customers would work very closely with our sales force, also known as their pharmacy business consultants, to ask for threshold increases and or assist with the due diligence requirements that we requested to be supplied to our controlled substance monitoring team members. Now, how is that going to change on July 1st?
Again, back to the independence portion of the injunctive relief terms. We are asking our customers to no longer reach out to their salesperson with any questions around thresholds or our program requirements. Instead, customers should visit our brand new website, it's real simple, www.cardinalhealth.com/CSMP. Website's going to be a key resource for all of our customers. It'll have all the detailed information around our controlled substance monitoring program. It'll have the form needed that they can submit for questions around the program, including that ever important threshold change request. It'll have detailed instructions around how we're going to collect that pharmacy customer data, the PCD, from the customers. And we've got a lot of really good answers around commonly asked questions that we've received so far.
Wow, that website sounds like a fantastic resource for our customers. So Todd, I'd like to thank you today for taking some time to talk about the changes our customers can expect on July 1st. And I just want to reinforce that great website resource, which is found at cardinalhealth.com under the About Us tab.
Yes, absolutely. And thank you, Hollie. I'm glad we had the chance to do this. And I just want to close by saying we really appreciate all of our pharmacy customers. We fully understand the critical role that they play in our nation's healthcare system, and we want this process to try to be as painless as we possibly can. That's why we're trying to get a lot of these factors out early so the customers know how to navigate through the process and we can avoid impacting patient care.
Great. Thank you.